Healthcare and Obamacare by Madeline Mortensen. Healthcare is the diagnosis, treatment, and prevention of disease, illness, injury, and other physical and mental impairment in human beings. There are 3 types of healthcare. This includes primary care, secondary care, and tertiary care. Primary care. This is the healthcare a person receives day to day by a healthcare provider. This is normally the first contact point of continuing to care for a person. This primary specialist coordinates with the other specialists that the patient may need. So depending on the health or condition of the patient, they may be referred for secondary or tertiary care. Examples of this would be physician, nurse, and pharmacist. Secondary care. This is the healthcare services provided by medical specialists and other health professionals. Normally, these people do not have first contact with their patients. This includes acute care, meaning necessary treatment for a short amount of time for a serious illness, injury, or other poor health condition. Examples of this would be cardiologist, urologist, dermatologist, psychiatrist, and physiotherapist. Tertiary care. This is specialized healthcare normally for patients who are on referral from a primary or secondary health professional. It's located in a facility that is advanced medical investigation and treatment. Examples of this would be neurosurgery, cardiac surgery, and plastic surgery. Obamacare, also known as the Patient Protection and Affordable Care Act. It expands eligibility of Medicaid, and it requires most Americans to purchase health insurance. It was signed into law by President Barack Obama on March 23, 2010. It was created to give more Americans access to affordable quality health insurance and to reduce the growth in U.S. health care spending. Obama explained why the reforms were necessary from an economic standpoint. This legislation will also lower costs for families and for businesses and for the federal government, reducing our deficit by over $1 trillion in the next 2 decades. It is paid for, it is fiscally impossible, and it will help lift a decades-long drag in our economy. Healthcare insurance options. There's private insurance, available through work or purchased on your own. There's supplemental insurance, and that's through Obamacare. And there's Medicare, which is for retired people, and it's a federal health insurance program for people 65 years or older. There are 4 parts to Medicare: Part A, B, C, and D. Part A is hospital insurance, B is medical insurance, C is Medicare Advantage plans, and D is prescription drug coverage. Obamacare Medicare reform aims to improve care for seniors and their families. Medicaid is for the poor and disabled people. Are you for it or against it? People either strongly disagree with Obamacare or strongly agree with it. Why some people may be for it? These people normally argue that Obamacare makes health insurance more affordable. Why people may be against it? These people normally argue that it's too expensive or that it infringes on rights to choose for themselves.